We're in another edition of Talking Together. We're joined by Dr. Ruth, who is a virologist who studies internal medicine. She's a medical doctor as well as a PhD, who spent a bulk of her time, a bulk of her work focused on the HIV/AIDS virus and its epidemic. Thank you so much for joining us. Give us the basics. For those folks who don't know what a virus actually is, they hear it, but what it actually means in scientific terms.
It's a tiny little particle. It's a protein shell with a piece of genetic information inside. And the genetic information inside can either be in the form of DNA or in the form of RNA. Your cells and my cells carry the genetic information in the form of DNA. But the virus that causes COVID-19 carries it in the form of RNA. The correct name of the virus that causes the COVID-19 disease is called SARS coronavirus 2. You can remember the difference because COVID-19 has a D at the end. And that is that helps you remember that we are actually talking of the disease.
The disease. And the disease is the shortness of breath, the fever, the dry cough, stuff like that.
The key symptoms, shortness of breath is the most severe one. Fever is the most frequent one. Cough.
And so speaking about viruses, because everybody gets it, you hear them tell you over and over again, 6 feet social distancing, wash your hands constantly. But how do viruses, because I think every virus spreads differently, but how do viruses normally spread?
Well, like you just said, each virus does its own thing. That gets right now to the key question. How is the SARS coronavirus 2 transmitted? It's an airborne virus, unlike many others. Since the virus is spread through the air, a person who sneezes, a person who coughs, even a person who speaks always emits some of these tiny droplets.
So you hear, because there's so much misconception and so much misinformation about this, both virus and this disease out in the public, Dr. Ruth. So talking about these droplets. So if I were to go to the store, for example, right? Let's say I'm at the grocery store. I don't know if I'm positive or negative. I'm asymptomatic and I sneeze, right? Which is releasing these nasal droplets. How long do they last? What do they last longer on different surfaces? So what should people be doing? But I think people have to know, like, okay, so I sneezed, now what happened?
And that is, if you have to cough, if you have to sneeze, you do this. You do it in your elbow. You don't do it, into your hand. This stops many droplets from, dispersing. We don't know who is infected with the virus. We don't know who could be spreading it. But we do know that everybody is susceptible and everybody could be potentially infected. And for that reason, the distance of 6 feet should be kept because, in medicine, there is this principle of universal precaution. We've learned this long ago in medical school. Every blood sample is considered potentially harboring an infectious agent. And even if you test the blood sample for viruses or pathogens that are known, you still don't know whether or not there is something else lurking for which there is no test. So for that reason, when you go to the clinic and have your blood drawn, the phlebotomist or the nurse or physician wears gloves, and every blood sample is considered potentially infectious. Potentially infectious. So the same principle now applies for the COVID-19 situation. Every person at this stage should be considered potentially infectious, potentially being able to spread the virus, and every person is potentially a target for the virus.
Wow.
The universal precaution basically works both ways. The person who doesn't know that he or she may be a carrier of the virus, by keeping the distance, protects friends and neighbors and family. And the uninfected person, by again keeping the distance, protects him or herself and therefore prevents from being an unknowing spreader of the virus later on.
And speaking about unknowing spreaders, I think that's part of the misconception is like people don't know if they have it, if they don't have it. And I think this speaks for not only speaks for COVID-19, but a lot of other viruses. Am I sure I have it? Can I go get a test? I think in the HIV work, we've now seen that testing is something that you can go. They can, rub your cheek, and then a minute later, you'll know if you have HIV or not. COVID, it seems to be getting there. There seems to be new talks this week about a 15-minute exam where you do it, and then you'll know in 15 minutes whether or not you have COVID-19 or you have the coronavirus. But what's the biggest misconception about viruses that you hear being put out in the sort of news media or the ethos, and what's the biggest misconception?
Just because you don't feel sick, just because you don't have a fever, does not mean that you cannot be a carrier of the virus. Many infected persons, have no symptoms, and they still, their body still replicates the virus. They're still spreading it, but they have no idea that they are a carrier. They have no symptoms. That is part of the problem.
And speaking about that, so on the science of viruses, are we implementing, from a scientist perspective, right? Are we implementing the right strategies to combat COVID-19?
Well, the right strategy is social distancing, social distancing, and also do the five. Do the five. What are the five? Number one, wash your hands, wash your hands, wash your hands, wash your hands very frequently.
All right.
Two, I just showed you this.
Number two. So wash your hands, number one. Number two, sneeze in your elbow.
Number three, the face. Do not touch your face. This is hard to do. And if you have a partner or a coworker, that means, well, maybe you need a face coach to remind you not to touch your face. These are habits that are inborn. People do it because it's a natural instinct.
That's number three. Don't touch your face. Number four, Dr. Ruth.
Number four, the 6 feet distance.
6 feet distance.
And number five, if you feel sick, call. Don't just go to an emergency room. Don't just go into a clinic. Call.
Call the doctor.
Call first. You need to find out what the procedures are at the healthcare facility that you potentially should go for people to get a test or to be evaluated. So you need to call first.
Call first. A couple more questions for you, right? So how do we fight, if you were advising a governor or a mayor, how would we, outside of these 5 things, how can we effectively fight this via policy? How do we fight this smarter?
The message should be loud and clear. Do the 5. Do the 5. Do the 5. And for especially younger people, and I'm a mother, I have dealt with teenagers, as you know. The younger people need to be reminded that they are not invincible, that they too can be affected, and that, yes, they should really follow these do's.
So now I have an in-depth question for you, because there's been some studies and some articles out about the possibility of using PrEP drugs, so prophylaxis drugs like, antivirals, retrovirals used to treat HIV, to treat COVID-19. What is your sense? Do you think that this is an effective treatment? Does this mean that if you are somebody who's on PrEP, that you are less likely to contract COVID? Just your thoughts on that.
Let's be very clear. There is nothing with proven efficacy to prevent or treat the virus that causes COVID-19. There is nothing. What is needed is data. We need to find out what works, what doesn't work, what is safe and effective. And that requires participation of people in clinical trials. Some of them are now starting. And yes, you mentioned some drugs that are used against other viruses potentially could be effective against the virus that causes COVID-19, but it needs to be shown. You can't just assume that it works.
And talking about that for just a second, because there has also been this push and this urge, well, if more people get it, we'll eventually get quote unquote herd immunity, which is when enough people have it, so that we carry enough antibodies to sort of beat it from a population perspective, which is sort of the impetus that, you know, we've seen the federal government utilize to sort of say we can reopen government and reopen businesses once we get herd immunity. What's your take on that?
Well, once again, you know, science rules. And do we know that people who have recovered cannot get infected again? We don't really know. So again, this requires clinical studies. This requires observation. But right now, we cannot just assume that people who have recovered will not get infected again. I have heard anecdotal reports from colleagues in China that there have been cases of people getting infected a second time. You know, it's anecdotal reports that needs to be examined.
And a more question about you, Dr. Ruth. So you've studied HIV/AIDS for decades, right? Will COVID-19 and this sort of pandemic that we're in, will this change how you do your daily work every day outside of the 5 things, but like from a scientific perspective? Will this shed light on how we deal with other viruses? Will this impact how you do your research?
The prediction is that this is something that could happen again. Transmission of a virus that is circulating in a certain animal species, then jumping to the human species, and the human species will have no immune defenses against the new virus. There is going to be a massive spread until, you know, the immunity that gets acquired suppresses the further virus spread. What do I hope can happen ASAP for the current situation? My own feeling is that inhibitors of enzymes that are critical for the virus to replicate will be the fastest way to help further spread. And there is one enzyme that the virus really needs. I mentioned at the beginning that these particles contain the genetic information of RNA. The virus by itself is just sitting there to replicate. It needs to infect a host cell, an animal cell or a human cell, and then it commandeers that cell to make copies of the virus. But still, at the end, the RNA needs to be packaged into new particles, and the RNA needs to be copied. While normal cells don't do that. I mentioned your cells, my cells have DNA. We do not have an enzyme that copies RNA again into RNA. This enzyme is called RNA-dependent RNA polymerase. And since your cells and my cells and human cells don't have this enzyme, the RNA-dependent RNA polymerase of SARS coronavirus 2 is a good drug target. That's my hope, that the pharmaceutical companies will soon find inhibitors of
the
enzyme.
And so let me get this right for folks listening at home. So if the pharmaceutical companies zero in on getting a drug that will inhibit the enzyme, your body will intake the coronavirus, but it will not be able to replicate it, which is where folks get sick, is when it comes in, it hits your nasal cells and just replicates.
Exactly. Yeah. If that is stopped because the drug does not allow, this critical enzyme, RNA-dependent RNA polymerase, to do its job, then there is not going to be a multiplication of the incoming virus, and the virus is, in other words, stopped dead in its track. It cannot replicate.
Is that very similar? So just for folks just to get some understanding of it, is that what PrEP does for HIV, right? Like you can come in contact with HIV, but if you're on a prophylaxis, I think that's the right name of it, then you're able to stop the replication in its tracks.
Exactly. That's what's happening as a prophylactic. But still, the principle is the same. If you target the critical enzymes that the virus needs for its replication cycle, and the human cell doesn't have such enzymes, you have very good drug targets. The protease, this is also a good drug target. Protease is an enzyme that cleaves viral proteins into smaller pieces. HIV has a protease, and this HIV protease is specific for cutting the enzymes, for making more HIV particles. And the SARS coronavirus 2 also has a protease, and its job is to cut down precursor proteins that the SARS coronavirus 2 needs to make more particles into the building blocks. That too is a very good drug target.
We've got some good drug targets, Dr. Ruth. Hopefully the pharmaceutical industry is listening. I want you to get back to your research so we can continue to fight viruses like coronavirus and especially HIV/AIDS, which is where the bulk of your research is. I want to thank you so much for joining us on this edition of Talking Together. We really appreciate you. I'm sure that we'll be having more conversations with you as this research continues, because I got to tell you the truth, Dr. Ruth. The truth is that you hear it on television, but if you don't know the meaning of the basics, you don't understand what they're saying. You just know you got to stay 6 feet away, and you got to wash your hands, but you're not sure why. So thanks for spreading some light on that, and I'm sure we'll have more combos.
Okay, well, thank you for your time.
Thank you for your time. We'll see you on the
My
next
pleasure.
edition of Talking Together. Dr. Ruth, we appreciate you.
You're welcome.